You are watching a video on how to add the procedures that you perform in clinic to the simulation playground in SimChart. Most doctors' offices are now using electronic medical record to document all work that's done on a patient. Paper charts are no longer being used. It's an excellent idea to get yourself familiar with how to electronically document all the work that you do. So to do that, you're going to go into the SimChart program, and then you're going to go into the simulation playground. Now remember, this box pops up. Since we have already added ourselves as a patient, or maybe some of your fellow classmates as a patient, we are going to go to return to previous session with save patient information. If you by accident start a new simulation, all of the work that you've previously entered will be gone. So make sure that you're going to return to previous session and start. Okay, so that brings us to our front office tab. Next thing we're going to do is go into clinical care, because now you're in the clinic. Okay, so the next thing we're going to do is find a patient. So we're going to go ahead and put in our patient. In this case, I put in Miss Ross. Go. And I'm going to choose, there she is. I'm going to choose her radio button and select. Now Miss Ross's information pops up. Okay, so the next thing that we're going to do is we're going to create a visit, because she is coming to our office to have something done. So let's go to our office visit, and a create new encounter window pops up. So let's go ahead and put in a visit. So we'll just put in, say, annual exam, and then we're going to pick a provider, and we're going to go save. So this brings up our encounter window. And under here, we see all of our options to document things that we've done. So let's go ahead and just take a little peek at what's here. So let's go to vital signs. So that's the first thing that we do when patients come into our office, is we bring them into the back room and we perform our vital signs. So here's our vital sign window. You see one for the vital signs and then for height and weight. So in the morning when you come into your class and your instructor wants you to perform your vital signs and your heights and weights, you can bring up yourself, or you can bring up a fellow classmate's SimChart account and then go ahead and document. So we're going to go add. And this is where we are able to put in our, document our findings. So let's say that we did our Fahrenheit temperature, which is normal, and then we're going to select a site, and we're going to do our pulse and our site, and we're going to do our respirations. Then we're going to document our blood pressure, the site we used, annual with cuff, and then the position our patient was in, sitting, hopefully. If we did an oxygenation rate, a pulse oximeter, we would put that there. And then we're going to go save. And then we're going to choose our height and weight. And we're going to do our height. We're not going to worry about percentile because we're not doing growth charting. If you were to do a growth chart on a child, then you could upload your file with your plotted findings on it. Let's do our weight. With most adults, we don't have ounces, and we're not using percentile because it's not a child. Method is our standing scale. We're not worrying about mother or father's stature because it's not a child. We're going to go save. Now notice that all of our information came up. So how handy is that, that we now have a spot every day that tells what we did and what our findings were. So we can go back to the record, And then we can put in a chief complaint. We can finish a health history, immunizations, medications. So let's go ahead and then just kind of look at our order history. Click on order history. Now, one great thing about the playground is we can explore it a bit and we don't have to worry about messing anything up. So if we come into here, we have our in-office order history, and we can go to the add button, and then select will give us areas of things that we can do in the office. So let's say that we performed a Snell and eye exam. We can put what our findings were. This patient has very good eyesight. Correction type would be if they were wearing glasses or contact lenses. And then you can put in your initials. And any notes. And then we can roll the scroller down and then go save. And our eye exam pops up. We can record just about anything that we do in the office here. So when you are performing your injections, you can go to the immunization. You can also go into medications. If your instructor gives you a scenario, we can go, let's look at preventative services. Preventative services gives us different things that our patient could be scheduled for. We can go into progress notes. Progress notes could be a place where we can document things that are not on here that we would like to make sure that we save. Here are diagnostic lab results. So here's our cardiology section where we can put in our path and lab section and our results. So there really is a place for everything. Please work with your instructor if you have any questions, and feel free to use this as often as you like. The more you use it, the more comfortable you will become with documenting the things that you will need once you're out in the workforce. I hope that this was a video that was helpful, and have a good rest of your day, and I hope you enjoy SimChart.